Hello, my name is Vaikuntan Rajaratnam, and this is part of my assignment for Instructional Design and Technology module, Managing Intellectual Capital. I work in Khoo Teck Puat Hospital, which is a hospital in Singapore. Khoo Teck Puat Hospital is one of the new hospitals opened in 2010, which caters for the community in northern Singapore. It is an acute care and a general hospital with 570 beds. It's a government-run hospital, and in Singapore it is one of the restructured hospitals, meaning that it also accepts private patients for care. As a healthcare industry hospital, we are involved in a knowledge-based industry, as what we do is to utilize the intellectual capital, which is the knowledge that our staff, doctors, nurses, and allied health professionals have with the relationships with patients and other partners involved in the delivery of healthcare, together with the organizational structures and processes through which we deliver a high quality care for our patients. So the fundamental processes involved in the delivery of healthcare is the way in which we manage this knowledge, and therefore we are in a knowledge-based industry. Our fundamental process is we collect data every day, from patient encounter to the assessment of patient's condition through various vital signs, blood tests and radiology, plus all the data that is entered through the various transactions that occurs during the delivery, assessment, and management of healthcare. This is then stored as information within our systems, and from which personnel will then obtain these data and information, and through their thinking process obtain knowledge from which decisions are made to ensure a high quality care is delivered. Truly a data-based industry. So what makes us unique in being a hospital, which is a knowledge industry, is that we have a significant portion of our value in the organization is based in our non-tangible assets. The building or the machineries are pure enablers for us to help deliver our care. So our basic, fundamental, unique selling point is our non-tangible assets, which consists of basically classified into three areas, which is human capital, which is our people, the structural capital, which is the organizational structure and processes and enablers that allow the people to work in a way that is effective and empowered to deliver quality care. And then we have our patients and partners, that is the vendors, the various other healthcare groups that we partner with through which to deliver this. And this relationship that we have with the external partners and also our patients, who are fundamental in our business, plus the people within our organization, is what produces our non-tangible assets, which can be classified as intellectual capital. Once again, our intellectual capital, therefore, is human capital, structural capital, and relational capital. So what a business does is basically takes resources, usually in the form of plant and machinery, with raw materials, to add value to it through its processes and to produce a value created item, which is then markets and obtains revenue to fund for the process of producing its product, services, and then the balance is kept as profit. In our organization, the most important component, as mentioned earlier, is our intellectual capital. So the intellectual capital is our resources that is used and utilized effectively to produce our services. Yet, in the financial statement of our organization, intellectual capital is not incorporated and is not reported anywhere. And the data of the intellectual capital is not even captured. And I quote our Chief Financial Officer, who says that we don't capture any intellectual property in our financial statement The conditions to recognize intellectual properties are fairly stringent, and we don't have anything that qualifies. So why is intellectual capital important? Intellectual capital is important and crucial in the day-to-day running of our hospital because it is what that allows for the effectiveness of our hospital. It provides the opportunity to produce innovation within our staff through their various interactions and processes. It adds value to the service that we provide. And crucial in healthcare is the intellectual capital that helps us reduce errors and litigation, therefore cost to society, to our organization. And it's the driver for growth. How do we expand and we innovate our processes of delivering healthcare comes from IC. It is the driver for quality in our care, in healthcare. And the importance and how we measure and value intellectual capital in our organization will be responsible for the attraction of talent and the retention of talent, which is a major problem in Singapore. And most importantly, intellectual capital is what will help us to maintain our sustainability throughout time. So we can see, therefore, that we need to manage our intellectual capital in Khoo Teck Puat Hospital. How we do that? We don't need to reinvent the wheel. The CIMC model, which is the Comprehensive Intellectual Capital Management Model, is a useful tool that we can use to help us to understand our intellectual capital, to capture and record these capital, and report on them after measuring its valuation. Even though it's not a regulatory requirement now to report our intellectual capital, maybe it is time now for the organization to have a separate addendum to the annual financial report, which is our intellectual capital report, based on current evidence in the literature on the best form of reporting intellectual capital that is reliable and accepted. So if the organization would like to go down this path of trying to capture and record and report on intellectual capital, I think the first step would be to do a strategic audit and to break down three areas of intellectual capital, which is the knowledge management, the innovation management, and intellectual property management, and do a strategic audit on where we are now, what we would like to do, and where we would like to be in the future. So this would be crucial prior to us moving along the path of comprehensive intellectual capital management. Basically, three things needs to be done during the strategic audit of the whole organization towards an ICM program, which will be what are the structural changes that needs to be done for us to be able to deliver a comprehensive intellectual capital management. I think in the creation of new posts and departments within the organizational structure, the creation of communities of practice among various human capital components, i.e. clinical staff, the clinical teams, the administrative staff, to produce changes and innovations. And there needs to be change in the culture within the organization in which innovation is encouraged, that intellectual capital and development is not only encouraged but enhanced and supported, and also to encourage the reporting of innovation and the development of intellectual capital, and also to assist and share in the commercialization of the various intellectual properties that can be obtained during the process of the ICM. The third thing is to make sure that all these things are being able to be produced and created and stored There should be enabling systems and tools within the whole organization to manage the whole intellectual capital. This could be in the form of IT systems to help capture, record, publish, and edit various artifacts that are created by the intellectual capital, to the encouragement of training and education of the staff members in the production of intellectual capital. It could also be in the networking and collaboration within the organization and without the organization, both locally, nationally, and internationally, to produce some very robust relational capital that would produce some interesting and valuable intellectual capital. So for knowledge management is the process in which we're going to do the initial phase of collecting all the intellectual capital that's within the organization. I think the first thing is to give it value and ownership, that senior management considers this as an important part of the organization, is to then create a department of intellectual capital. Now, why a department? Because the intellectual capital consists of so many components. It may have at the same level contributions from the human resources, but human capital is concerned with operations where innovations can be created there, and in terms of the research and development unit. But it's important to create organizational change that reflects the thinking and the importance that senior management plays on intellectual capital. So there will be a requirement for a structural change. Looking at the current structure of the organization, there is a chief transformation officer, which probably correlates well with innovation, but that's just one component. But we probably need a much more robust, holistic change in the roles and functions in senior management to put somebody in charge of intellectual capital. There must be a cultural change within the whole organization in which the management must communicate and reinforce that intellectual capital is crucial to the sustainability of the organization, and therefore it will empower and celebrate intellectual capital management within the organization. Intellectual capital has to be incorporated as part of the total performance management system of each and every staff in the hospital. If only when we reward them, these may not have to be monetary reward, but reward them in terms of recognition, in terms of meritorious awards, which would go well in the motivation of the individuals to participate in both the creation, the recording, and the enhancement of intellectual capital within the organization. Thirdly, we need to install enabling systems and tools to help in the process of collecting, codifying, classifying, and recording these various intellectual capital. The use of self-reporting and publishing systems within the intranet will help in this. The importance of providing networking and collaboration within the hospital through social media will be another tool in which we help to enable people to communicate and relate with each other within the organization to create knowledge management platforms and processes. For innovation management, the structural change would be the creation of positions like innovation managers in each strategic unit. Now, this doesn't have to be an added post, but existing team members can be given a title of an innovation manager, given responsibilities and roles to help in the development of innovations within their various units. Team members are already involved in innovation in the form of Kaizen projects, which is continuous improvement, and this needs to be formalized. And we have a tremendous pool of talent that exists within the organization, which sometimes people consider as more of a liability, which is the residents. The residents are the trainees who come through our system. we need to incorporate the residents into these innovations management. As part of the residency training, there is the clinical program and improvement program, which is required as part of the residency. So each resident over his term of 4 to 5 years is required to produce projects that will produce clinical improvement and patient improvement programs, and these has to be done over a cycle of 3 to 4 years to show an improvement. And by incorporating this, we will be able to empower our trainees, and who will not only produce some interesting innovation, but also teach them the importance of innovation as part and parcel of being a professional physician. The cultural changes, again, the only way to drive this is through encouraging innovations to be included in the TPM, the Total Performance Management Systems, and the trainees being educated and trained in the importance of system-based improvements in their education, and how this can then be integrated and recognition given to the trainees. As part of the training program, that every trainees will require to complete one innovation program as part of their residency training. Once again, to enable these things to occur, we require systems and tools, and what apart from the self-design and implementation tools that can be made available online for individuals to create innovations. Things like running process re-engineering can be included online with tools and templates that will assist people to analyze their processes and improve. And through this, we can have a system of recording. The important component to comprehensive intellectual capital management is to train, and e-learning will be a useful strategy to help in the training and education of the members of the organization on innovation. As a hospital, intellectual property management can be both very tangible and also esoteric. But in terms of intellectual property, apart from the standard IPs that are patents and inventions that comes from research, which are not that common, but a large component of intellectual property that is created by clinicians are the various original research papers and articles that are published in the peer-reviewed journal. So this is important to be recorded, and therefore part of the structural changes that need to be done is to expand the function of the clinical services and to encourage the recording of the various intellectual properties that have been created. To facilitate this, we need to have a system of classification and accreditation of our various intellectual property. For example, if there is a clinician who has developed an application, who wants or has developed an app to help in the diagnosis of disorders, then this needs to be classified as an application invention, helped him to achieve that through the funding of writing various codes and creation of the app, and then commercialization of the app, and which then can go into finally as a tangible valuation of that intellectual property, and that can be included into the intellectual capital statement. The next is again to encourage the cultural change through the inclusion of intellectual property creation within the total performance management system, and this would included into the rewarding system of the individuals. Again, the importance of enabling systems and tools. Apart from self-reporting systems, we could use the current available social media like ResearchGate for the verification and validation of the various intellectual property artifacts created by the individual physicians and clinicians. ResearchGate has tools that will help in the validation through cross-referencing of journal articles that's been published, and there is an index that it creates. The education of IP creation is important, and that a lot of clinicians are not aware of how to create intellectual property, and this is important in the terms of things like the generation of research questions, the methodology of research, and the creation of an original paper, and that should be encouraged. And the encouragement of networking and collaboration with those local and international researchers is useful, and the use of social media like LinkedIn and ResearchGate should be encouraged as part of the enabling system and tool to produce intellectual capital. So in conclusion, it can be seen that comprehensive intellectual capital management is crucial for Kutik Butt Hospital as it moves forward. The current environment for competitive healthcare with scarce resources demands that we listen to the people on the ground and use the various resources that is available within our community, which is the patients, our doctors, and our partners, and our organizational structure to ensure that we are able to deliver healthcare within our resources with high quality and effectively. Management needs to demonstrate its commitment and support for this program, and that this program is actually feasible with our existing resources, and will require a cultural change from within the whole organization, and this can be provided through effective communication about the importance of intellectual capital to all stakeholders. Periodic reporting of our advances in intellectual capital management needs to be made public and is essential to encourage and to ensure sustainable change in behavior of all stakeholders to ensure the success of intellectual capital management. Thank you.